Sleeper stretch. So with this stretch, what we're doing is we're looking to use our forearm as a lever arm to rotate into internal rotation. When we do that, the upper arm bone has a head on it, your humeral head, that will rotate into the back half of the joint, and it puts pressure into that capsule. So what we can see is if you have a relative stiffness in that back half, when you go to rotate in, the part of the upper arm, that humeral head, it can't access the back half of that joint. When we do shoulder rotation drills, a lot of people have a really hard time not compensating through their shoulder blade, and they get this shoulder blade that rounds and tips forward, which creates anterior tilting of the actual shoulder blade unit, the shoulder unit, so it doesn't isolate pure glenohumeral internal rotation. So we can go to the ground and use the ground as an anchoring point to have some biofeedback and then move into internal rotation. So onto your side, and then what you're gonna do here is I like to cue to use the off foot to push your foot into the ground, and it's gonna vary kind of depending on what is going on with your shoulder, what's the most comfortable position, and where you can feel the greatest amount of stretch without having like a painful response. So simple place to start is to be at about 90 or just a little bit below. The further you go up, the more aggressive it's gonna be, the more of a stretch you're gonna feel. Now the other piece is a lot of people that we give this to have sensitive shoulders. You gotta challenge the beliefs of, is that pain, is that a stretch, is it uncomfortable? Because it really matters in terms of when do we stop, when do we keep going. If you're having a truly painful response, then obviously you need to adjust the position or adjust how hard you're pushing through that shoulder joint, because it should not be a painful response. A very strong stretch is normal. The other piece is, where do I feel it? It's normal to feel it coming all the way across that front half of that shoulder down into the side of your arm. So when I get set up, again, using this foot to kind of stabilize, I'm gonna go slightly below. So that would be 90, that 90-degree angle relative to my side, slightly below that. And I'm gonna actually kind of push the back of my arm down into the ground. You can see that it makes me get a little bit taller as I do that. I use my off hand, and I'm gonna rotate down to where I feel like a pretty strong stretch. Now in this position, I like to add a little bit of load. So I don't like to just hold this position. I like to go to where I feel a stretch, take the off hand, push the off hand down, and then push the arm that's being stretched back into it. So I'm creating relative external rotation. I like to hold that for about 10 seconds. And then I like to take this hand off and I like to reach toward the ground going that way for 10 seconds. So I'm going from an external rotated position, isometric, to an internal rotated position, isometric. And I'm gonna push back. I'm gonna push in, and I'm gonna keep playing with that. And then if I wanna be more aggressive, I can just bring my elbow a little further up, push down, now I get a bigger stretch. And again, I'm pushing down, pushing back, 10 seconds, and then I take my hand off and I reach toward the ground as hard as I can for 10 seconds. And I'm being really mindful of, am I compensating through this joint? This position, it makes it really hard to be able to compensate through that shoulder blade, and it allows the motion to come from the glenohumeral joint, which is just the upper arm bone rotating on the shoulder blade. And that's what we're trying to isolate, is that internal rotation motion.